As I went through 3 terrible years of becoming someone I didn't know that I was, and experiencing the 7 dwarves of menopause, which I call itchy, bitchy, sleepy, sweaty, bloated, forgetful, and all dried up, I thought I got to do something.
That, of course, was actress and Dancing with the Stars contestant Suzanne Somers. She's definitely got her energy back. She told her story to Biote Medical founder and president, Dr. Gary Donowitz. He has a new book called Age Healthier, Live Happier. Thank you so much for being with us today. Really appreciate you coming in.
Thanks, Jane. Glad to be
talk
here.
about this very important subject. So what is the solution for someone like Suzanne and so many other women who are suffering from symptoms just like she described?
Well, you know, it's not just women, it's men and women, and it's not just the patients, it's the doctors. Patients have different needs. You know, they all want to actually feel their best no matter what their age. Doctors want to help the patients feel their best. The problem in our healthcare system is everybody gets pills and pills and more pills for all these diseases. No one prevents those diseases. What if you optimized your hormones with something this small? It's a small pellet that you did a couple of times a year and could prevent diabetes, heart disease, breast cancer, Alzheimer's, and osteoporosis. That's really what patients want.
Okay, Dr. Donowitz, what is the difference, though, between, and in layman's terms, between bioidentical hormone therapy and traditional synthetic hormone therapy?
Yeah, you know, Jane, bioidentical hormones are the same as what your body made. Same testosterone, same estradiol. So your receptors, the things in your body that receive those hormones, are looking for the same hormones that you had when you were younger and when you felt your best. They're not looking for horse estrogen. They're not looking for synthetic hormones. So the receptors don't receive them the same. That's why the side effects are so different. Bioidentical hormones make you feel better and protect your body. Synthetic hormones come with a whole host of side effects, blood clots, heart attacks, strokes. That's all covered in the book. So now people can actually take hormones safely. Most people are afraid of hormones. You shouldn't fear the hormones.
Okay, if a woman chooses to have hormone therapy, when is the best time for her to start? Should it be when she hits menopause, when she has premenopausal symptoms?
You know, that's a great question, because people start losing hormones. Women start losing hormones in the late 20s. So if you were to wait to menopause when you were 50 or thereafter, all of those years your body's not protected. Your brain is losing brain function. Your heart is not going to be as good. You run the risk of developing diabetes. Why not protect your breast, your heart, your bones, everything, and you actually feel better? Now, when you start losing testosterone, your energy goes down. You don't sleep as well. You start getting that belly fat. So what do? You get on diet pills and fad diets. That's not the way. This book will show you how, if you keep your hormones optimized, even from your 20s to the time of menopause and thereafter, then you feel your best no matter what your age.
I've got a question. We see a lot more these days, low T clinics and all kinds of things like that. What about men?
Yeah, the low T clinics are really using shots, which again are synthetic hormones. They're dosing those every 2 weeks. So they have 2 or 3 really good days and then 10 bad days. The proper thing is to use these small pellets. When you use the pellets that are this small and you put them back here in the hip, now men can also enjoy the same benefits. The thing of it is, those hormones are there all the time, when you need them, not taking shots. You would have to take so many shots that you never stay on those in the long term.
Let's quickly take a look at what Suzanne Somers said about you, Dr. Donowitz.
It's the best thing I've ever done for myself, and I will take them till I die. It's great that there's a doctor like you that took it so seriously, and you're spreading the word, and maybe we get the whole globe on bioidentical hormones. I think there'd be less war, there'd be a lot happier marriages. I think the world would be a better place and much wiser.
It would. Thanks.
Okay, Dr. Donowitz, your book, Age Healthier, Live Happier, is out April 23rd. Is that right? All right. Thank you very much for coming in today.
Thanks so much for having me.
Really appreciate it. And you can pre-order that at biotemedical.com. You can find out much more about bioidentical hormone pellet therapy online, and just go to the website biotemedical.com. We'll be right back.